All right, today we're going to dive into a crucial part of your body that you use literally every single day, but probably don't think about until it starts hurting. We're talking about the rotator cuff. We're going to break down what it is, how it gets injured, and most importantly, how to keep this unsung hero of your shoulder healthy and happy.
So, let me ask you a question. Have you ever really thought about what's holding your arm in its socket? I mean, what's the magic that lets you throw a ball, or reach up for something on a high shelf, or just lift your groceries? Well, it all comes down to a really brilliant, but kinda unstable piece of engineering.
Okay, here's the best way to picture it. Think of a golf ball sitting on a golf tee. The ball, that's the head of your upper arm bone, and the tee, that's the really shallow socket in your shoulder blade. Now, this design is amazing because it gives you an incredible range of motion, right? But you can also imagine it's not very stable. That ball could fall off the tee pretty easily.
And this is where our hero, the rotator cuff, enters the story. It's not one thing, it's a team of 4 muscles and their tendons that wrap around the shoulder joint. They act like a dynamic, living stabilizer, constantly making tiny adjustments to keep that golf ball perfectly centered on the tee no matter how you move. They're the reason your shoulder can be both incredibly mobile and stable at the same time.
So who are the members of this A-team? Well, let's meet them. There's a super handy acronym to help you remember them. SITS, or SITS. Each one of these muscles has a very specific and very vital job to do.
Let's break down how this team works together. The S is for supraspinatus. It sits on top, and its main job is to get your arm lifting out to the side. Now, this one has to pass through a really narrow space, which is exactly why it's the most commonly injured of the 4. Then you have the infraspinatus and teres minor in the back. They work together to rotate your arm outward, like when you're winding up to throw something. And finally, the subscapularis is in the front, and it does the opposite. It rotates your arm inward. It's this beautiful, constant push and pull between them that gives you smooth, controlled movement. But, like any team that works this hard, the rotator cuff is definitely prone to injury. And when things do go wrong, it usually happens in one of 2 main ways. So on one hand, you've got acute or sudden tears. This is the classic stuff. You fall on your outstretched arm, or you try to lift something way too heavy, way too fast. It's a single traumatic event. Bam. But on the other side, and honestly this is way more common, are the chronic tears. This is that slow burn kind of damage. It's wear and tear. Think about a baseball pitcher or a painter who works overhead all day. Aging and reduced blood flow to the area are also big factors. And here's one we can all relate to. Poor posture. When you slouch, the physical space in your shoulder for those tendons actually shrinks, leading to pinching and friction that just slowly wears them down over years.
So how would you even know if you've injured your rotator cuff? Well, your body sends out some pretty clear signals, and doctors have a really well-defined path to figure out exactly what's going on.
The number one hallmark symptom usually isn't a sharp, stabbing pain. It's this persistent, dull ache deep inside your shoulder. And here's the classic sign. The pain gets worse when you lie down at night, especially if you lie on that shoulder. For a lot of people, it's bad enough to actually wake them up from a deep sleep. Beyond that constant ache, you're probably going to feel weakness. Lifting a simple jug of milk might suddenly feel impossible. Everyday tasks like combing your hair or reaching behind your back become painful chores. And you might experience this weird thing called a painful arc, where lifting your arm out to the side is fine at the beginning, but then it gets really painful through the middle part of the motion, and then it feels okay again once you get your arm all the way up. To confirm a tear, a doctor's going to start with a physical exam. They'll move your arm around, test your strength, and really pinpoint where the pain is coming from. An ultrasound is often the next step. It's quick, easy, and it uses sound waves to get a live look at the tendons in action. But the real gold standard is an MRI. That gives the clearest, most detailed picture of everything, confirming if there's a tear, how big it is, and exactly which part of the SITS team is hurt. Now for the good news. A rotator cuff injury is not a life sentence. Not at all. There is a very clear path to recovery, and it almost always starts with a more conservative approach. This is really important to know. Surgery is not always the first answer. For the vast majority of partial tears and chronic injuries, the focus is on conservative care. What does that mean? It means things like rest, changing how you do certain activities, using ice, maybe some anti-inflammatory meds, and the big one, targeted physical therapy. Physical therapy is like a structured journey back to health. Phase 1 is just about calming everything down, controlling the pain and inflammation. In Phase 2, the focus shifts to gently getting your full range of motion back. Phase 3 is absolutely key.
This is where you strategically strengthen not just the rotator cuff itself, but all the supporting muscles around it to create a much more stable shoulder. And finally, phase 4 is all about getting you back to your life, whether that means playing tennis or just being able to put dishes away in the top cupboard without pain.
Now, surgery definitely has its place. It's usually the right call for those large, full-thickness tears from a sudden injury, or for cases where months of dedicated physical therapy just haven't solved the problem, especially in younger, more active people who really need to get back to a high level of function.
You know what they say? The best injury is the one that never even happens. So let's wrap this up with a simple playbook for prevention, so you can protect these incredibly important joints for the long haul.
These are really the keys to keeping your shoulders healthy. A proper warm-up gets the muscles ready for whatever you're about to do. A balanced strengthening program, especially for the muscles around your shoulder blades, gives your rotator cuff a solid foundation to work from. Posture is huge. Remember how slouching shrinks that space? And finally, just being mindful of repetitive stress and making small tweaks to your workspace can make a world of difference over time.
When you think about it, your shoulders are your physical connection to the world. They let you hug the people you love, lift your kids, work, and play. They are absolutely worth protecting. So the question I want to leave you with is this: what's one small change you can make, starting today, to take better care of them? Thanks for tuning in.